Hello everyone, welcome. This is Venkat Talapnini. As part of this presentation, I am going to talk about Medicare and Medicare Advantage. Most of the people who are living in United States, especially elder people, are aware of Medicare, and there is a misconception about Medicare that it is completely free and it's provided by federal government, and it's partially true. So it's not completely free, and there are four parts of Medicare. So it's a part A, part B, C, and D. So let's look at what are these, how we categorize the Medicare. So Medicare is primarily categorized into four parts. So it's a part A, part B, part C, and part D. And we will look at what each plan covers and who pays for each plan, how this works, and what is the Medicare is provided by federal government, and Medicare Advantage is the plan that offered by private companies. So Part A is called hospital insurance. Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. And most people do not pay a premium for Part A if they or their spouse have paid Medicare taxes for at least 10 years, that's 40 quarters. However, there are deductibles and co-insurance amounts for services. This Part A funded primarily through a payroll taxes paid by employees and employers, as well as through premiums for those who do not qualify for premium free Part A. So as if you observe your payroll, so every month, or for every payroll, you would be paying taxes towards Medicare, and from that amount that you already paid, the Part A is being covered. However, as you see here, so you should have been at least worked for 10 years to eligible for Part A premium free. And even if you are not worked and you never worked, but if your spouse worked for at least 10 years, so the person who did not work also eligible for Part A premium free. So in case if you or your spouse did not work, and then even for Part A is not free, you would need to pay a premium to get the coverage for Medicare Part A. So that is nothing but hospital insurance. So in summary, Part A covers hospital insurance, generally premium free, funded by payroll taxes. Since most of us work, and we would have been at least worked for 10 years, so this would be covered by federal government. So Part B plan is called medical insurance. So Part B covers outpatient care, doctor visits, preventive services, and medical supplies. Part B has a monthly premium, which is typically deducted from Social Security checks. Beneficiaries also pay an annual deductible and 20% co-insurance for most services. As unlike Part A, Part B is not completely free, but it has a premium. So if you are already eligible for Social Security benefits and you already have money in the Social Security, then it would be deducted from there. Part B funded through monthly premiums paid by beneficiaries and general revenue from federal government. So yeah, this is another myth. Probably you would be thinking Medicare is completely free. As we see under Part B, medical insurance is not completely free. And Part B, in summary, it covers medical insurance, monthly premium funded by beneficiary premiums and federal revenue. And Part C. So the Part C is called Medicare Advantage. So the original Medicare is Part A and Part B. So in case if anyone would like to have extended service like dental, vision, hearing, and so far we haven't even seen the pharmacy coverage. So This one will be covered through Medicare Advantage. So the Medicare Advantage is an alternative to original Medicare provided by a private insurance companies. So the Medicare Advantage is offered by private companies. So these plans often include Part D, so that is a prescription drug coverage, and may offer additional benefits such as dental, vision, hearing, and even wellness also can be covered through Medicare Advantage. So as you see, if you are 65 and above, and Part A and Part B covers only hospital care, hospital coverage, and medical coverage, medical insurance coverage. So in case if you want to have an extended coverage on top of what already provided as part of Part A and Part B, so Medicare Advantage is the solution. And you can go and opt for Medicare Advantage plan. So since most of the private insurance companies provide this one, you can take the Medicare Advantage that obviously already including Part A and Part B along with additional coverage, and that covers as well Part D, so that we will be discussing in the next slide. So that is a pharmacy coverage. Even if you are taking a Medicare Advantage, you continue to pay your Part B premium, and there may be an additional premium for the Medicare Advantage plan. Obviously, since you are going to get additional coverage, and you would be paying like additional premium for Medicare Advantage, funded through a combination of Part B premiums, additional premiums for the Medicare Advantage plan, and payments from Medicare to the private insurers offering these plans. In a nutshell, Medicare Advantage combines Part A and Part B, often includes Part D, funded by premiums and federal payments to the private insurers. So the Part D is called prescription drug coverage. So as so far we have seen the other plans, right? Part A and Part B cover hospital insurance and medical insurance, and Part C, as part of, if you take Medicare Advantage, you would be covering dental, vision, hearing as well. However, for all these, you would be going to pharmacy to get medication, and that medication is not covered as part. Pharmacy benefits are not covered under Part A and Part B. So under Part D, which is a part of, which is offered through Medicare Advantage, covers the prescription drug coverage. So Part D helps cover the cost of prescription drugs. These plans offered by private insurance companies approved by Medicare. Part D requires a monthly premium which varies by plan. Beneficiaries also pay a share of the cost for their prescription, co-payments and co-insurance, and may have annual deductible. So, as you notice here, this is Part D coverage. It's pretty much like in any other regular insurance that you are buying. So you are responsible to pay premium for prescription drug coverage, and like any other medical coverage, the regular one, not non-Medicare. So you would be sharing your cost, either it's a co-payments or co-insurance, and you will also have a deductible. So who is paying it? Most of the time, funded monthly premiums paid by beneficiaries, general revenue from the federal government, and state payments for dual eligible beneficiaries, those who qualify for both Medicare and Medicaid. So in a nutshell, Part D covers prescription drug coverage, monthly premium, and funded by beneficiary premiums and federal revenue. Hope this video gives some understanding, and whoever is planning to take Medicare, or you are planning for retirement, you may need to understand it is not going to be completely free. You would be paying some sort of premiums for Medicare, and if you are taking a Medicare Advantage, obviously there would be extra premium that you would be paying for Medicare Advantage, since that covers additional coverage that includes dental, vision, hearing, and as well as you can even opt for wellness programs as well. And also it covers the prescription drug, so that's pharmacy, it covers. So yeah, hope this slide this presentation gave you good information to plan, or at least to aware, what is a Medicare and how it works, and what it covers, what is not covered. um, yeah, thank you for watching. If you like this video, please like and subscribe to my channel. Thank you very much.